Sripal Bangalore, Mike Gibson, talking to you about his AHA presentation on TUXEDO-2, comparing the two leading agents in the field, Ticagrelor, Prasugrel, in people with multivessel disease and diabetes. Sripal, what did you find?
So in the trial, I mean, the reason we designed the trial was because in terms of, I mean, we have been using these agents for a long time. It's generic in the US, and there is only one head-to-head randomized trial, the ISAR-REACT-5 trial. We tested Prasugrel versus Ticagrelor and found Prasugrel to be superior in reduction of ischemic endpoints without paying a price in terms of bleeding. But they found that in the diabetic subset, there was no difference between ticagrelor and prasugrel. So we took that hypothesis, designed this large randomized trial, 1,800 patients with diabetes and multivessel disease. In fact, 85% of the patients we randomized had triple vessel coronary disease, and they were all undergoing PCI. And the trial was designed based on the hypothesis we had from ISARI Act 5 to prove that ticagrelor is actually non-inferior when compared to prasugrel. For a primary, it was more of a net benefit endpoint, both ischemic and bleeding, and we had a non-inferiority margin of 5%. And if ticagrelor proved to be non-inferior, the hypothesis was secondarily we'll test for superiority of ticagrelor when compared to prasugrel. In terms of the results, what we found was ticagrelor was indeed not non-inferior. The upper limit of the difference between the two event rates exceeded the non-inferiority margin. So it was not non-inferior. In fact, for all endpoints that we tested, the point estimates for ticagrelor actually had higher event rates than that of prasugrel. And in two of the pre-specified analysis, patients with diabetes duration less than 5 years, ticagrelor was associated with significant increase in the risk of primary endpoint events when compared to prasugrel. And interestingly, the same was true if you compare it in the subset of patients who are deemed to be high bleeding risk. So ticagrelor statistically significant worse outcomes when compared to prasugrel.
Has anyone done a meta-analysis yet? Are you planning one to kind of put all that data together?
A great question. So, at the AHA presentation, I presented a quick meta-analysis it was a trial level, only two trials, ISAR Act 5 and Tuxedo, where we showed that prasugrel reduced the risk of death MI stroke by 22% when compared to ticagrelor. And if you look at the major bleeding, there was no significant difference between the two. But going further, we have a larger meta-analysis in the works.
Great. Well, congratulations, Sripal. Well-conducted study, important answer. Thanks for joining us today.
Thank you. Thanks for having me on.